Men's health is a subject that is overlooked in public health, government, and in the media. In recent years, there have been more discussions surrounding the stigma men face when they ask for help, but there is a lack of solutions that result from these conversations. Policies that aim to provide insurance and better medical coverage for all can sometimes subvert men's health unintentionally. The disparities within men's health are not addressed, which causes coverage gaps and increased stigma. Another idea that causes harm to men's health is the criminality of mental illnesses. Men make up the largest demographic of incarcerated individuals, with many of them having experienced some form of mental illness. Punishing men for displaying signs of mental illness, not addressing insurance gaps, and the idea that prioritizing men's health will take away from women all contribute to the continuance of predatory health policies that disproportionately impact men. Currently, in the United States, the amount of money that is spent on healthcare is increasingly high. For men's health, this is due to the fact that men will neglect their health concerns until their condition becomes severe. This drives up the cost of healthcare for men because instead of having a cheaper and earlier intervention, they are being treated for their more serious and neglected health conditions. Men on average die 6 years before women do in the United States, which is a result of how much our society neglects the health of men. Low-income men are more likely to be uninsured than low-income women. This is because they often work jobs without employer-sponsored health insurance. Men's health is not a common subject that is discussed because society has deemed it unimportant. In the past, many doctors and researchers thought that women were overutilizing healthcare, while men were doing it correctly. While proven false, the idea that men do not need to go to the doctor as frequently as women still stands. This is one of the many reasons why men face stigma when they want to address their health concerns. In most global health organizations, including the World Health Organization, policies about gendered healthcare typically center women and children. This is also the case within the United States as well. In many states without Medicaid expansion, childless adults cannot enroll in Medicaid or receive coverage. This policy disproportionately impacts low-income men because they are less likely to have a child be their dependent. The lack of care for men's health, especially racial minority or low-income men, is what causes them to face increased barriers to accessing health services. Also, under the Affordable Care Act, most insurance plans must cover birth control without out-of-pocket costs. While this is a great aspect of this policy to ensure safety and accessibility, it doesn't include vasectomies. While many insurance plans cover most or all of the costs of vasectomies anyway, it is not in writing that they are required to. The Affordable Care Act has achieved many accomplishments for the American healthcare system, but it lacks a focus on men's health and the barriers that they may face. Including men in federal government policies can help widen the discussion and resources available for men who are struggling with their health. When facing mental health struggles, men are taught they are weak for asking for help or displaying their emotional side. Due to this stigma, they often engage in externalizing behaviors that get them in trouble with the law. According to the Federal Bureau of Prisons, 93% of prisoners are male. About 2 in 5 people who are incarcerated have a history with mental illness. Discriminatory policies that affect men who experience mental illnesses include zero-tolerance policing, nuisance laws, and mandatory sentencing for drug crimes. Men struggling with mental illnesses are much more likely to engage in substance abuse because that is deemed a more socially acceptable way for men to deal with their concerns. Policies that criminalize drug use or enforce zero tolerance for the mentally ill are disproportionately harming men. Mentally ill individuals or someone who is battling substance abuse need support from healthcare professionals, not involvement with the justice system. The idea that mentally ill men are inherently dangerous to society is pushing them to be punished for their mental illnesses instead of receiving the proper help that they need. These policies deepen the stigma and fear that men face when they want to come forward about their mental health struggles. When discussing men's health or gendered health policies, there is a common misconception that each gender is fighting over who should be prioritized. Unfortunately, some people believe that feminism and achievements in women's health are harming men. The idea that a win for women is a loss for men, or vice versa, is known as the zero-sum mentality. The zero-sum mentality is a harmful idea because it pins men's health and women's health research against each other. Prioritizing both men and women's health is vital, and it should be noted that the health of men and the health of women impact everyone. It is important for all of the United States that men's health research gains more traction. Collaborations between men and women's health research can result in positive outcomes for each gender. Gaining more funds for men's health research will not take away from women's health research. Men and women across the United States are currently facing many health disparities, and both should be prioritized equally. Currently, there is a lack of policies that directly address the health of men and boys. Researchers have created ideas of ways that policies can truly make an impact on men's health, not only in the United States but globally. Health literacy is one of the most pressing issues in men's health. Wider discussions about men's health have yet to be had, leaving many men unaware of the health challenges they are more likely to face. Implementing policies for health education that focus on men's health, as well as women's, starting at a younger age is one way to improve health literacy in men and boys. Creating culturally sensitive and friendly environments have also found to be another way to reduce the stigma and ensure that men have equitable access to care. Implementing policies that reshape gender roles can be a large step forward in taking down the harmful results of current legislation. Creating more awareness about men's health and the current barriers that set them back can help reform the already existing health policies to better include men. The United States has many landmark health policies that have been implemented, like the Affordable Care Act. Policies like the Affordable Care Act have done great work in shaping and reforming the American healthcare system, but there is an unaddressed issue in regards to how these policies may unintentionally harm men. Reforming these policies to ensure that men have the same access to health coverage, are not treated as dangerous when experiencing mental illnesses, and breaking down the zero-sum mentality can help reduce these disparities. Through this video, we hope you are more knowledgeable about the topic of health policies that may unintentionally harm men.